Gastroenteritis. Acute gastroenteritis, also known as diarrheal disease, is a common infectious disease syndrome causing a combination of nausea, vomiting, diarrhea, dehydration, and abdominal pain. It is defined as a disorder of the physiological functions of the stomach, small and large intestine, and as a result of the bacterial, viral, or parasitic infection resulting in the inflammation of the mucosal surface of the digestive tract. Responsible for significant morbidity, it is the leading cause of mortality after cardiovascular disease and the leading cause of childhood death worldwide. Many of the reported cases are as a result of the consumption of contaminated food or water. Occurring year-round, the disease is common in developed nations, however most commonly found in developing nations where the standards of sanitation are poorer and visitors often develop what is known as traveller's diarrhea. Typically, the disease and its symptoms clear within 2 weeks, although there are rare occasions where an infectious case can be persistent and become chronic in nature. Bacteria, viruses, and parasites that produce infectious acute gastroenteritis usually follow fecal-oral transmission. This transmission can be the result of a number of potential circumstances, ranging from the consumption of inadequately prepared food or water, poor sanitary hygiene, touching or eating from a surface housing the bacteria, or simple person-to-person contact. Bacterial gastroenteritis accounts for 15 to 20% of the reported cases and is the result of the invasion of the gut and the release of toxins. The common invasive bacterial pathogens involved are Shigella, Salmonella, Campylobacter, and E. coli, all of which usually lead to mucosal ulceration, abscess formation, and inflammation. The symptoms of bacterial infection can include severe diarrhea, dehydration, nausea, vomiting, fever, and dysentery. Non-invasive bacterial infection is less common but causes similar symptoms, with nausea and vomiting occurring more frequently. On average, the symptoms of bacterial gastroenteritis infections last anywhere between 2 and 10 days. Acute viral gastroenteritis is one of the leading causes of death worldwide and accounts for approximately 50 to 70% of all confirmed cases of the disease. The major pathogens involved are rotavirus, which is common in children under 5 years of age, and norovirus, common in adults and responsible for the major outbreaks. Viral infections result in the inflammation and decrease in function of the small intestine, leading to maldigestion and malabsorption. Symptoms relating to the viral infection include severe diarrhea and dehydration, abdominal cramps, nausea, vomiting, muscle ache, and low-grade fever. Typically, they last between 1 and 3 days, however severe cases can be life-threatening. Parasites are responsible for approximately 10 to 15% of all cases of gastroenteritis, with symptoms lasting up to 4 weeks, much longer than both bacterial and viral infection. However, it usually resolves without the need for intervention. Because of this sustained period of illness, symptoms of weight loss due to malabsorption and malnutrition, fatigue, and severe dehydration are common. In most cases of acute gastroenteritis, the infection will resolve on its own. However, the management of rehydration and prevention of electrolyte loss is critical to ensure the disease remains non-life-threatening. Rehydration with the proper solutions containing replacements for these lost electrolytes is important. The World Health Organization defines an appropriate solution for oral rehydration. However, prepared forms of this solution can be purchased from local chemists and supermarkets. In extreme cases of severe dehydration, and if symptoms persist, hospitalization and intravenous rehydration therapy administered through an IV line inserted into the vein on the arm or hand may be required. Some bacterial and parasitic infections may also require antibiotic intervention, with the World Health Organization recommending this course of treatment alongside oral rehydration in young children. Vaccinations are also available for viral forms of acute gastroenteritis and are recommended for children. If a child is presenting any of the following symptoms, nausea, vomiting, diarrhea, abdominal pain, fever, blood in stool, or dehydration, begin a course of oral rehydration therapy consistent with the World Health Organization's requirements for rehydration and consult your local medical practitioner. If symptoms persist, or in the case of extreme and severe dehydration, immediate hospitalization is required and intravenous rehydration therapy will be administered.